All right. Well, thank you everybody for joining the call this evening. We did one of these calls back in July. Many of you might remember, to kind of talk about the second half of 2019, and now we're into 2020, and we're going to kind of talk about what's coming up. Just to kind of go over what the agenda is going to look like today. We are there we go. Just going to go over just something quickly about the volunteer structure, talk about 2019 success briefly, then do some federal updates, do a state update and talk about what 2020 has in store, and then a little bit about State Advocacy Day, and then we will open it up for questions at the end. So with that, I'll get started. So first on the volunteer structure, just as a reminder for everybody, our volunteer structure here at the Alzheimer Association for Advocacy, we have ambassadors. They are tasked with one in each member of Congress, and they are kind of our person, our face to that congressional district or that congressional member, and work one-on-one to create a relationship with them. We have ACT members in each of those congressional districts or with those congressional members, and we're trying to have 2 or 3. I would say right now we have almost a full slate of ambassadors. We still have one opening out there, and we are getting close to having 2 or 3 ACT members in every district. So that's great. The new thing that we started at the beginning of 2019 was state champions. We're now up to about 16 state champions across the states. We have some new ones have just joined this year. And we're really excited to have that new layer, and I think it's going to be really important when we start talking about our state update as we're trying to get things done in the states, especially with the new campaign we have going on. With that, I also want to throw out there this idea of mentors, and if any of our seasoned ambassadors, ACT members, or even state champions have been doing this a while, are willing to be a mentor for a new volunteer, I'm definitely interested in talking to anybody that might be interested in that about it, just so from a volunteer to volunteer standpoint, we can connect some new people with some veterans so they can get a better understanding of what you do, how you stay active throughout the year, and just be kind of a help there for them. So that's something new this year that I'm looking to hopefully expand into, and if anybody's interested in being a mentor to a new volunteer, please let me know. All right, next, 2019, just quickly to go over our success in 2019, we had quite a few. First, at the federal level, I think everybody's aware, we got $350 million of additional research funding. That takes us to a grand total of $2.8 billion, which is remarkable. In 2011, we had $458 million in Alzheimer's research funding. So in less than 10 years, we have gone from that $500 million to $2.8 billion. That is remarkable progress. Additionally, we got $10 million of funding to implement the BOLD Act, which passed just over a year ago, which is the Building Our Largest Dementia Infrastructure Act. And we actually need $20 million a year to fully fund that, but we did get $10 million in this first year, so that was a great success. And we'll continue to build upon that. In the state, we had 2 victories. The first one, we were pushed all last year for a 5% funding increase for the My Choice Medicaid waiver, which allows disabled folks to stay in their home longer, avoiding nursing home care while getting Medicaid services. Many of those people are dementia patients. We did get that 5% increase, effectively really dropping the wait list that we talked about down to possibly just 1,000 people or something around there. So that was a huge success. That's helping people already. And then the other success is we pushed last year for the Michigan Dementia Care and Support Program. And this is a program that we had in the States up until recently, 2017, when it was cut, surprisingly, at the end of the budget negotiations, but that allowed for care counseling in certain counties in the state where care counselors could come into people's homes, to anybody who wanted it, and talk to them about care planning, talk to them about resources that they need, and really guide them through what they can be doing when they have a dementia diagnosis in the family. And so that was a big success this year. We got that. We did pass that. It will be effective in 10 counties. Those counties are, everybody's going to ask, so those counties are Allegan, Kent, Lenawee, Macomb, Midland, Monroe, Oakland, St. Clair, St. Joseph, and Wayne counties. And that program is just getting underway because the program passed the legislature but was actually vetoed by the governor. And then the governor and the legislature came to an agreement right in December at the end of the year and included that money back in. So we got $400,000 in state dollars to fund the Michigan Dementia Care and Support Program moving forward. And so that's pretty exciting. And that's going to lead into kind of what we're doing this year at the state level. And I'll talk about that in just a couple minutes. So that we had some great successes. One thing I want to let everybody know that that's a unique year, especially at the state level. To win on both of our top priorities was extraordinary and great. With all my 15 years experience being in Lansing, that rarely happens with organizations that they actually win on both. But I think it's a testament to, we did a lot of things last year with action alerts, emails that people went out. We pushed people to go to coffee hours and talk to folks. We had people at coffee hours, at town halls, talking directly with key lawmakers like Mary Whiteford, with John Hoadley, down in Kalamazoo, with other key lawmakers. And I think that really made a huge difference. Created some more champions in the legislature for us on those issues, and we're going to look to continue that type of success moving forward in the new year. Now, just quickly on a Fed update, I don't have too much to update on the federal level. As people might be aware of, there's an impeachment trial going on. I guess it's been over all the headlines, but I don't watch the news. So, but that's happening. So a lot of things in DC as far as the Senate goes have come to a standstill, which is important with our federal update, because one of the things that we have going on for us is the reauthorization of the Older Americans Act, which passed the House. It sits in the Senate right now. It's something we would love them to move. Who knows if they will, because the Senate is doing impeachment right now. But that Older Americans Act is important because within it includes key provisions of our Younger Onset Alzheimer's Act. And so if we can get reauthorization of that, we will have successfully gotten done what we set out to last year with the Younger Onset Alzheimer's Act and get basically resources available to older Americans, which are currently only age 16 and above, would become eligible for those with a younger onset diagnosis. Additionally, we talked about the funding. We're going to come back again this year and push for more research funding. We always need more. You can't get complacent. We got to continue to push for more funding. We have not gotten an exact number yet. I'm sure before the national forum, which is in March, we will get an exact number of what we're pushing for, but we don't know yet. I already mentioned $20 million we're going to need for BOLD for next year to continue implementing that act. And then lastly, a big push that I know is going to happen this year is the Improving Hope for Alzheimer's Act. So last year we started off pushing for co-sponsors of that legislation. I'm happy to announce here in Michigan, we have 10 of our 16 members of Congress are co-sponsors of that legislation. We're going to continue to push to get the other 6 to move that forward. If you're not familiar with the Improving Hope for Alzheimer's Act, it's very simple. We passed the HOPE Act several years ago. That allowed for physicians to bill Medicare for care counseling. So if someone gets an Alzheimer's or dementia diagnosis, then they can set an appointment for care counseling, and their physician can actually bill for it. And that's huge because obviously if the physician's not going to be paid for it, their office is not going to have those. So that was a huge and exciting win to be able to have physicians bill for care counseling. However, nobody knows about it. They did a survey and found out that less than 1% of those diagnosed were taking advantage of it, and probably because patients don't know about it, providers don't know about it. So the Improving Hope for Alzheimer's Act will basically make the Centers for Medicare and Medicaid get the word out on that. More importantly, maybe, is that they'll have to report back to Congress each year what are the obstacles that are actually leading to people not taking advantage of that. So we're going to continue to push that this year. And like I said, try to get those last 6 members of Congress in Michigan to sign on as co-sponsors. So that's what we have going on in the federal update at this time. The one action I'll say that we're having, most everybody going to forum knows about this. Our ambassadors, we're pushing district meetings right now. Please set up those district meetings as soon as possible. If you can get them with a member of Congress, that's awesome. That's also very difficult. So if you have to quickly move to getting a meeting with the member of Congress's district staff, please do that. We want to get those meetings done. It'd be great to have all those meetings done by the end of February. I don't really want to push us right up to forum trying to get our meetings in. So please do that. I will also say that any volunteers can drop by a district office or set up a meeting to talk about these issues. And if you're interested in doing that, please let me know, because the more people we have roll into these offices talking about our issues, just the more important our issues are going to look to those staff and to those members of Congress. They're hearing from multiple people in their district. So let me know if you're interested in that. I can hook you up with who you need to talk to and information you need to take in. So, and with that, I'm going to move on. Keep in mind, I'll open this up for any questions at the end. So if you have questions about anything that I've covered, just hold on to them, and I will open up at the end and we'll answer them. So the next thing I want to talk about is the state updates and our big campaign moving forward this year. And so this year we are going to be pushing what we're calling our Building Michigan's Dementia Infrastructure campaign. And it kind of is a mouthful, but basically what we've found out is in Michigan, we have no infrastructure within the state government, so within the Department of Health and Human Services, to deal with dementia. There are sporadic programs within that department here and there, but we do not have any infrastructure. We do not have dedicated staff working on dementia. We have very few programs. The biggest program is actually our program, the Michigan Dementia Care and Support Program, which we just got brought back in. And so we're looking to move the ball forward in a much bigger way in the next year. And so let me take you inside a little bit of how we got to this point here today. I mentioned earlier that we fought for the Michigan Dementia Care and Support Program for several years and had a pilot project in place with a few counties way back in ending in 2017. I mentioned that in 2017, to our surprise, the legislature cut that funding quickly, and we lost it. And then we fought up until last year, all those years, to try to get that funding back. Last year, we were successful in getting it back. Then once again, the governor chopped it again with the veto, and we had to fight again to get the veto overridden and into the supplemental budget. And so what does that all mean? What I think that means is that our program sitting out there by itself is always going to be at kind of an easy target for legislators to cut because it kind of stands alone. It's not within a department. It's not really within a unit working on something specific. So it's kind of always going to be at that. And that really showed itself with the whole veto fight last year when our money was vetoed. It showed that our program kind of just stood out to legislators as something that can be easily taken away. And we don't really want to be in that position anymore. Also, we have multiple priorities moving forward that we need to do if we really want to move Michigan forward in tackling Alzheimer's and dementia in this state in an aggressive and also in a more proactive and effective way. Fighting for a program and getting a program is great, and that's going to help people, but we need to move beyond that into fighting for larger programs, bigger pools of money, and really advance the fight here in Michigan. And so what we did is that we have been working basically ever since the veto happened. We have been working with the state health department and specifically the Office of Aging and Adult Services on making dementia have direct dollars going right into a dementia unit. And so this has taken a lot of meetings and conversations back and forth to get them on board with exactly what we want to do. But we have now gotten to the point where we have the health department and the Office of Adult Services and Adult and Aging Services on board with us. And so moving forward, this is what we're going to be pushing for this year in Michigan. We're going to be asking the state to build the first dementia infrastructure. And how we're going to do that is we're asking for $800,000 of specific funded to create a dementia unit within the Office of Aging and Adult Services. And that dementia unit is going to include the Michigan Dementia Care and Support Program, our program, at $400,000. It's also going to include $300,000 so that we can hire a state dementia services coordinator and other staff like a coalition coordinator in the states, and it will provide basically seed money to start a public health awareness campaign in the state. There's a lot more we can do, need to do in the state, but we felt that those three priorities right now is what we need to do to really get our foot in the door and moving forward on this. And the most important thing is this would be state-specific money going straight into a dementia-specific unit. And if we can succeed in that, we can come back every year and then instead of saying we need $400,000 for this and we need $300,000 for this program and this, we just come back every year and say we need an additional $250,000 for the dementia unit so they can add data collection to what they're doing. So they can add this program that has been proven to be effective in some other state. So we want to get to the point where we're actually we have one ask in funding. The funding is for a dementia unit, and within that unit, we're doing multiple things. And we're tackling this disease at multiple levels. And so I think everybody's pretty much aware on the Michigan Dementia Care and Support Program. I described what that was and what we're doing. Let me describe just slightly a little bit of what a coalition coordinator would do and what they would do. I sent you our policy priorities for the year in the last email that I sent with a reminder yesterday, and it kind of lays it out briefly in there. But having a state dementia services coordinator and a dedicated dementia staff person or people in the health department means we're going to start to be able to collaborate within that health department with other areas of chronic disease, with other areas of health departments, starting to get dementia into different recommendations and different guidelines that are being done so that it's starting to be recognized in training and different things like that. We'll have a person in the health department there that will be responsible for identifying gaps, identifying all the programs that the state offers that deal with dementia so that we can start communicating together, make sure we're not duplicating efforts, make sure we can find out where more programs are needed. They would be there also to, and I think this is a really important thing, we would finally have dedicated staff in the state of Michigan actually looking at what's available in the federal government and the Centers for Disease Control and seeing what grants are available, what kind of money can we apply for nationally and bring into the state. It'll cost us nothing. It costs, we just need staff that are dedicated to bring that money in. And there are programs, there's money available. Problem is we don't have dedicated staff looking for it. We may have a staffer in chronic disease, the overall department that wants to do something with dementia, so they might apply for something, but it's really all over the place and sporadic. And what we want is people in the dementia unit looking for those opportunities and bringing that money to Michigan so that we can do those programs here, so that we can establish more things here in the state, that we can build this robustly. To give you an idea of this, we have other sections or units in the state of Michigan that deal with different chronic diseases. There is a heart disease section, there's a cancer section, there's an obesity section, there's one that deals with opioids and arthritis, there's injury control, there's all sorts of these different sections that deal with things. There's not one unit or section that deals in dementia. And so we need to kind of up the profile of our disease, get to that level, dedicated staff. Those other units or sections, that's what their staff are doing. The cancer section has staff looking to draw down federal dollars. In fact, in many cases, those sections actually rely way more heavily. The majority of the money that they utilize is federal funding, and only a fraction or a vast minority of the money is actually state funding. But they can take that state funding and they can draw down millions of dollars from the federal government to tackle their disease. And that's what we want to do with dementia. We want to be utilizing state-specific dollars and then drawing down federal dollars so that we can really tackle this disease at a large level here in Michigan. And that's why it's so important to have staff in doing that. There's other things that obviously staff like that, having a coalition coordinator. We have a Michigan Dementia Coalition in the state. If we could have state-specific staff within the health department, within the Office of Aging, that are coordinating that coalition, it really raises the level of that coalition, especially in the eyes of legislators and the health department. I don't want to say it legitimizes it, but because it's a legit coalition, but it just adds another level to that of effectiveness that we could be doing in the state. And then the last thing I think is kind of self-explanatory, a dementia public awareness campaign. It's just badly needed. The money that we would be putting towards it in this first year is not that significant, but it's the idea of starting that and having staff utilize that money to hopefully get some partnerships to get more media buys or something like that for a awareness campaign that would be, know the 10 signs or something like that. But to create the start of an awareness campaign that hopefully will grow over time so we can get more word out, not just to people, but to providers. And there's multiple areas and ways we can go between encouraging people to go in and be checked so that we can increase the number of diagnoses so that people can get the resources that they need, make things more aware to providers. There's just so much that could be done, and there's so much more public awareness that needs to be done that we felt this is our opportunity that we need just to start, and we need some seed money to start it up. And so that's what that would be doing. And so this is going to be our ask. This is actually going to be our single ask at our 2020 State Advocacy Day this year. Is we're going to be asking all of our legislators that we want them to back Michigan's first dementia infrastructure, and that's creating this dementia unit in the health department. And I'm excited about this because I think it's big, it's bold, and it's going to take some work. We may not succeed in the first year, we may not succeed in the second, but hopefully in 2 to 3 years we do succeed and we have a dementia unit. And I think once that's established, it's going to change the game for us completely. It's going to be a place that's going to be there. It's going to be extremely hard for the legislature to take away because it's going to be a unit within a department, and that's a whole different thing than just some standalone program. And it'll give us a place where we can come and advocate for more dollars and identify even more things that need to be done and put into that. And obviously house programs and staff that are making direct change in people's lives right here in Michigan. And obviously the more money we can draw down and bring in, the more impact we're going to have on people's lives. So that's kind of the big new campaign that we have going on. I did mention State Advocacy Day. Just to mark your calendars, it is April 28th, 2020. The link to register is already live. If you need that link, I can send it out to you. We'll be doing a big push, probably starting in February, to start getting people registered for that. So you'll see more emails about that from me. One thing I do want to mention about State Advocacy Day this year is we are moving. We'll be in the Radisson Hotel in Lansing. We have outgrown the Mackinac room in the House Office building, and we need a bigger space. So we'll be in the Radisson Hotel this year, and we will be going to the House Office building, to the Senate building for our meetings, and we will be ending in the Capitol again this year. So look forward to that, April 28th, and we'll be talking about this dementia infrastructure campaign. We are just getting our materials ready on this, so we don't have a one-pager for you yet or anything like that, but we do have the public policy priorities, which I sent out to you, that can be used if you're talking to lawmakers or things like that. That leads me to my last thing before I open it up to everybody for questions, and that's action. And we actually need a lot of action around this. It's brand new. Nobody knows about it. No legislator knows about it. We've only begun discussions with the governor's office we started in December with governor's office and had our first meeting with them to talk about this. Our lobbyist, Todd Tennis, had a meeting with them following up last week. This is one of the reasons you all saw the action alert that we sent out targeting the governor for State of the State addresses next week. We wanted to get as many emails in because we want to get dementia on their radar, get them thinking about it, let them know about it. I'm happy to say we had almost 300 people take action. So we had almost 300 emails go into the governor's office. That's going to get their attention. Hopefully that will lead to some progress on this front with the administration. But outside of the administration, we need to be talking to legislators. And so the action item for you guys this winter, spring, as we get into State Advocacy Day, is we need folks to get out there to coffee hours, have a meeting, district meeting. If you can't meet with them, set up a phone call to start talking to your legislators, start educating them on why we need state-specific dollars going to dementia in this state, and why we need to establish a dementia unit. And so hopefully all the information I provided you today is not overwhelming and will help guide you. But if you need more information from me or need to talk through it a little bit more, feel free to email me or call me. But we really need to start getting people out to coffee hours and out there to talking to these legislators, start talking to them about dementia, telling them your story, telling them how little Michigan does to help people in the state with dementia, and why we need direct funding for this chronic disease, where so many other chronic diseases have direct funding and dementia does not in the state. And that is a huge gap that needs to be corrected. So we need to get out there and start talking to them. If anybody is interested in doing coffee hours, office hours like that, you can usually find those on their websites, but feel free to email me or contact me, and I'm happy to look them up or call their office to find out when they're having office hours or things like that. If they don't have them, I'm happy to try and work with you to set up a meeting with them in the district so you can talk with them directly. And we always can make phone calls to their office to talk to them or set up a phone call with the legislator. We've had advocates do that, and that's been very successful. So that's what we want to do. And then very important, aside from that, when you're done doing those things, I need people to report them in the allsimpact.org website. So I know who's done what, and we have it recorded so that I can go back and look and remember, yes, this person went and talked to this person 1 or 2 times. And you can go more than once. In fact, it's great if you do. It's going to take multiple hits with these legislators so that they start to prioritize this and start to really think about this and take action on this. So that is all I had for now. At this time, I'm going to go ahead and open it up for any questions. And to unmute your phone, all you have to do is hit *4, unmute, and you can ask a question.
Hey, Matt.
Hey.
Hey, Matt. It's Michelle Barish and Ari Barish. On the unit within HHS, is there another state that already has a unit like this that's doing some amazing work that we could show the example to our legislators?
Yeah, and we're working on that to find other states that examples, but they are out there. So I would say this, Michigan's probably not the worst state when it comes to dementia, but we are by far from the best state working on dementia. And there are many states out there that already have one of these state services coordinators in place. There are states that do have state-specific money going to different programs or units or sections or things like that. So there are examples, and they're kind of all over the political spectrum, from Utah and Georgia to Maryland and Washington State. So we're going to put that together and have hopefully some examples for you guys to have. But yes, it is happening in other states, and they are tackling this issue in other states in this way. So Thanks for the question.
Okay, and I was just thinking, because, they would like, I think everybody wants a win. So if we can give our legislators a win by backing this and even maybe getting the governor on board with that, then, we give them a win without a whole lot of work on their part.
Yeah, and
Right.
the one thing I'll mention in case somebody's going to ask it, why $800,000? It's kind of funny but true that when you say $800,000, legislators say, "Oh, that's probably manageable." The minute you say $1 million, it sounds like a lot of money. And so if you're like, "We need $1 million," legislators balk at that. If you say $800,000, you get a whole different reaction. Right? It's only $200,000 less, but it's amazing how different it is. It's like all of a sudden it might be manageable, or it can possibly be done. For whatever reason, that $1 million mark is where people start to balk at, and they're like, "Whoa, why are we doing this?" And so we came to a conclusion that we needed $800,000 to do the 3 programs that we want. The Office on Aging and Adult Services agreed with that amount, and to have our program, the Care and Support Program, to have the staff in place, and then also to do public awareness. So that's where we came to money. But yes, these things are happening in other states and at different levels. Any other questions?
Okay, thank you.
You're welcome.
Yeah, Matt, Arnie Barish. Are these basically the same initiatives that the Michigan State Dementia Coalition is working on with all of their groups?
Right now, they are working on several different areas. This is something that we will share with them. But for example, there's one subcommittee there working on training requirements and things like that. So the Dementia Coalition is a little bit more far-reaching as far as the issues. They're not so focused on one like we are. But yes, this is something that Jennifer Leopard will be taking to them, as this is our priority with the Alzheimer's Association, and we strongly believe
that's what I was wondering.
It's actually
they have a 5-year plan.
Yeah, it's also keeping in mind this also has Dementia Coalition and partners in mind, because if we're asking for money for a dementia unit and we can start throwing all the programs that deal with dementia in there, then the day will never come where we're sitting across the table from another group working on dementia and they want funding for their program and we want funding for our program, and we're at a possible conflict of interest. So if we have one dementia unit in the state, obviously that's where dementia is going to lie, and us pushing it is naturally going to be where other people are pushing it to.
Thank you.
Welcome. Any other questions? Do not be shy. Once again, *4 to unmute your phone if you have a question.
Hey, Matt. It's Brian.
Yeah.
I get I was just actually checking the MDHHS website and realized that Rich Klein is not the deputy director anymore. But my question was, have we attempted to work within MDHHS, either through the new deputy director or Dr. Khaldun or Director Gordon or whomever, and have we, or is that part of the plan, is to kind of try to attack the thing from multiple fronts that way?
Good question, Brian. Actually, we went kind of to the top to start, and we had to determine where this dementia unit should be housed, whether it was in the Office of Aging and Adult Services or was it in the Chronic Disease Department. So we have been working with them from the top. So Dr. Khaldun knows about this. We've worked with Orlando Todd, who's over there underneath her, and covers all of those divisions, including the Office on Aging, including chronic disease. So we've talked with all of those folks. They're all on board. Many are excited that we're actually seeking state-specific dementia dollars and creating a unit in in their department so that it actually has dementia actually lives somewhere within the department now. And so, yeah, we've worked from all levels to get support, and that's kind of why it took so long. And we're just rolling it out now.
That's exciting.
Great, thanks, Brian. Any other questions anybody has? Once again, *4 to unmute your phone. All right, going once, going twice. All right. So hopefully, if any questions do come to mind, anybody can email me or give me a call at any time. I'm sure there will be questions as we start to move forward with this and roll out materials for everybody to use. But Brian, I think you hit it on the nose there. This is exciting. It is big. If we can establish this, it will be a huge step forward for us as far as tackling these. And it's going to be our primary focus this year in Michigan at the legislative level, and we're going to need everybody's help to do it. So we're going to have a lot of stuff for people to be doing throughout this year, from, like I said, coffee hours now, State Advocacy Day. We're going to make a big push on this State Advocacy Day. In June for Alzheimer's and Brain Awareness Month. We're going to try to do our media around that, letters to the editor, try to get that out there. So we are definitely going to be going at this full force and try as best we can this year to get this done. It's an election year, so everything is a little more difficult in an election year. But like I said, this is not something that we're going to stop at the end of this year. If we don't get it done this year, we're coming back next year, which is not an election year, and we'll push again and keep educating folks. But we're going to continue on. One other thing, everybody, most of you know, I called through most of the Ambassadors Act members midway through the year last year, kind of did a check-in. I'm going to do that again this year. In the next several weeks here, I'll be calling through everybody, including state champions, just to check in with you guys, see how it's going, see if you need anything from me, see if there's any way I can help you be more active, answer any questions you may have. So you'll definitely be hearing from me to set up a call with you. Most of those calls took about 20 minutes last time, but a great opportunity to just touch base and see how things are going. If you haven't been very active up to this point, it's not too late. We can always use more activity, and just because you haven't done anything in the last month or two, we still welcome you to do stuff when you can. And so please let me know if you can help. But any last questions before we go? All right, I don't hear any. So I want to thank everybody for joining tonight. I appreciate having you on. I thought those were great questions, and I really look forward to 2020 as a big year for us to push a big campaign here in Michigan. So thanks, everybody, and have a good night.
Thanks, Matt.